Hello, and thanks for joining us. Welcome to the 2020 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is navigating insurance to get the diabetes care you need. My name is Carla Cox, registered dietitian nutritionist, certified diabetes educator, and education specialist, and your host for today's program. Our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press star three on your keypad, and an operator will collect your question and place you in a queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Stay with us through the hour, and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart, with support from founding sponsors the Boehringer Ingelheim and Eli Lilly and Company Diabetes Alliance and Novo Nordisk, as well as national sponsors Sanofi, AstraZeneca, and Bayer. The No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. The health and safety of all those we serve at the American Diabetes Association is always our top priority. COVID-19 continues to be a serious public health threat. In general, people with diabetes face a greater risk of complications when dealing with viral infections, and that is true of COVID-19 as well. Current CDC recommendations to protect yourself state that you wash your hands often. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice safe social distancing and put distance between yourself and other people. And cover your mouth and nose with a mask or cloth face covering when around others. The ADA encourages people with diabetes to follow the guideline of the CDC and to contact your medical provider if you suspect that you are showing any symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-DIABETES. That's 1-800-342-2383. Like many of you, we are still practicing social distancing, and so we are proud to present this month's Q&A from our own homes. I am very happy to introduce our guests for today's event, Laura Keller and Laura Friedman. Laura Keller has been with the American Diabetes Association for over 20 years, starting in the local Seattle market as the youth program director for 5 years, and in that time she worked on camps and youth programs for kids and families with diabetes. As director of state government affairs for 9 states, she advocates for people on the state level to make insulin affordable, improve and protect insurance coverage and health care, and to end discrimination against people with diabetes. Working closely with state legislators, volunteers, community partners, and coalitions to promote our legislative agenda through legislation and positive public policies that seek to promote and improve care for people with diabetes. Laura Keller, why don't you tell us a little bit about yourself?
Hello, my name is Laura Keller, and as Carla stated, I have been a Director of State Government Affairs with the American Diabetes Association for several years, and I also live with type 1 diabetes. I'm happy to be here and excited to address your questions today.
Thank you, Laura. We also have Laura Friedman today joining us to talk about the Medicare Plan D savings model. Laura Friedman is Vice President of Federal Payment Policy for the American Diabetes Association. Prior to her role with the ADA, she worked for Healthcare Services Corporation, the parent company of various Blue Cross and Blue Shield plans for more than 20 years, where she was part of a public policy team managing issues related to Medicare Advantage, Medicare Part D, and others. Laura Friedman, why don't you tell us a little bit about yourself?
Thanks, Carla, and nice to speak to you all today as well. Carla, as you mentioned, I am the Vice President of Federal Payment Policy here at the American Diabetes Association. I am still relatively new in my role, just about a little over a month now. So really excited to be joining you all. I am primarily focused on finding ways for creative solutions for individuals with diabetes to have greater access to care and lower costs. I also am living with type 1 diabetes, so now we have two Lauras here living with type 1 diabetes on the team. So thank you so much.
Thank you both, Lauras. This may be a little confusing as we go back and forth from Laura to Laura. As we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with our first question. Many persons with diabetes are very concerned about what they need to have covered by their health insurance plan. Can you give us a couple of quick tips that may benefit our listeners?
Yeah, I would be happy to. People with or at risk for diabetes need to consider an insurance that has the following items to be covered: screenings and services as required by the treating physician, prescriptions, durable medical equipment. For example, that's an insulin pump, a sensor might fall into this category, your blood glucose testing, eye care, and that's beyond glasses, podiatric services, diabetes education, visits to a dietitian, dental care, and that's beyond just a cleaning.
Thank you, Laura. If you're just joining us, welcome to today's Ask the Experts Q&A. We're going to discuss navigating insurance to get the diabetes care you need. As a reminder, for those of you on the phone, press *3, that's *3, on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Now let's take the first question. Stephen, you're on. Stephen, can you hear me? You're on the phone.
My sugar levels are always in the high 300s and 400s, and I can't seem to get them down with taking my insulin. I test 4 times a day, and I'm supposed to take insulin 4 times a day. And my age, I'm very forgetful, and I forget taking it. Does Medicare pay now for the continuous insulin pump?
Do you want me to? I'll hop in there. This is Laura Friedman. Hi, Stephen. I believe, so I think you might be referencing, so there's 2 options. There is a continuous glucose monitor, which will, I believe there are some coverage options through Medicare Part D at the moment, as well as insulin pumps, although Laura Keller, if you know off the top of your head, if anything specifically is covered, I have to assume, I just don't know which ones off the top of my head.
Yes, so Medicare does cover continuous glucose monitors and insulin pumps for people in Medicare. You have to work with your doctor and to get that information to get it submitted, but they cover several now. So they used to only cover one option, but now they cover 2 different CGMs and pumps, and they're working on covering others. So you can work with your physician to do that. We can also direct you, if you go to Medicare.org, you can find out which pumps they actually and CGMs they actually cover.
Thank you. Teresa Hall, you're on. Can you please ask your question?
Okay, I'm not gone. I had, well, my question is finished. So I retired from the group commissioner, and they sent me a form to fill out to check off several insurances, and I don't know which one to pick because they didn't send me any literature to read through these insurances, and I don't know if they're going to cover my pre-existence or what. So that was my question. And if you need to know the insurance they for me to select. I can tell you that too. Hello?
I need a little more information. So are you in a Medicare program, or did you buy through a state exchange?
She is no longer online. Could you give some examples?
I can jump in on the Medicare. Sorry, Laura. So on the Medicare, okay, great. On the Medicare side, ma'am, there everything will be covered. There is no issues with your pre-existing conditions. Again, if you are trying to figure out, you should be able to, if you Google or search for Medicare Plan Finder, you can also find that from Medicare.gov. You should be able to search specific plans in your area, whether that's by state. You should also be able to check out, they have specific filters. That should be, if this is related to Medicare open enrollment, you will be able to look up those plans as early as Thursday, October 15th. So that's later, that's in 2 days. You should be able to filter for types of medications, state, plans that you're interested in, things like that.
Thank you. Diana Wattsmith from Pennsylvania, you're on.
What am I on, Pennsylvania?
Yes, you're on the line. Can you call? What is your question?
Oh, I wanted to know, like I was borderline, and back in 2012, the doctor gave me these prednisone pills and told me to take them. Well, I was pre-diabetic, but it took me into diabetes, and then then he was, putting medicine in me. I didn't realize what was going on till now, and then here they took me off the one medication and put me on the said it was elevating my levels, and so they put me on this insulin. Well, here to find out I was allergic to it because I found out there's one made in the lab and there's one made in that's human, that they take the genes out. So here, long story short, it swelled up my tongue. I couldn't eat. And I kept telling the doctor I'm allergic to this stuff, but he kept trying different ones. So I had ketoacidosis twice, and the last time the ambulance had to come get me, they had to go through my neck to administer medicine to me because they found out I was allergic to all the insulin. I think it was synthetic, so they had me on a natural one, and it seems to be working because I just got out the hospital for that ketoacidosis, and I'm really afraid. You know what I mean?
Diana, did you have a question on your Blue Cross and Blue Shield and Medicare?
I'm sorry. Yes, I have Blue Cross and Blue Shield of Michigan, and I thought since I had Medicare, because I keep getting these calls to the enrollment center, and I thought I had to renew, my Medicare every time. But I thought that was a stable, I thought it was stable that you didn't have to do that. So I was asking, is that possible? Did I have to renew it?
That's actually a great question. You do not have to make any changes. If you are comfortable with your plan and your Blue Cross and Blue Shield of Michigan coverage, you do not have to make changes from year to year. It will automatically re-enroll you. If you do want to make changes, Medicare open enrollment begins this Thursday, October 15th, and lasts through Monday, December 7th of this year. And that's for coverage for next year, beginning on January 1st, 2021. But you will not have to make any changes if you are happy with your current coverage. That's Medicare related only.
Thank you. Tammy from Hollywood, Florida.
Yes, hi. So right now I'm choosing new insurance through an employer, and I have 8 options through California Anthem Blue through the employer. I don't seem to have access to what diabetes meds and brands and supplies are covered and which aren't. So how do I find out before I sign up? It usually is like a surprise after we've signed up for the insurance, what we actually get. And my past experience is that the insurance company seems to dictate what brands of insulin I take and what brands of and supplies I should be usually using. I usually do go with a very low deductible because of the insulins. We usually spend, thousands of dollars a year. We don't want a $7,000 deductible. But everything else, how do I find out ahead of time what to choose? Thank you.
That's a great question. Thank you for asking that. One of the things you can do is you can actually call Anthem Blue Shield, the program, and ask them which are covered. Now, one of the things that can be a challenge is that they may start covering one particular brand of insulin or one particular medication, and that can change partway through the calendar year. There's nothing to prohibit them from doing that. So you want to do your best to ask those questions. The other thing is, as you know, there's different tiers of insurance. So by getting a plan that has potentially lower deductible and better coverage can help ensure that you get better access to the medications you need. Often the high deductible plans don't have the same level of coverage for your medications that a different plan would. So definitely look at that. But one of the things you can do is actually call them and ask, and they will give you that specific information. But just be aware, it can change during the calendar year.
So another question kind of along that line is, what is the out-of-pocket maximum mean on an insurance policy?
So the out-of-pocket maximum is the maximum amount you have to pay in a calendar year. And that includes your deductible, co-insurance potentially, and your copays. And in order to meet your deductible, you have a maximum amount. For example, if your deductible is $1,000, your plan won't pay anything until you've met your $1,000 deductible. After that, more coverage comes into place.
And what does co-insurance mean then?
Co-insurance is your share of the cost of a covered healthcare service calculated as a percentage. So, for example, maybe it's 20% of the allowed amount for your service. You pay co-insurance plus any deductibles you owe. For example, if the health insurance plan allowed amount for an office visit is $100, and you've met your deductible already in your plan, your co-insurance payment of 20% would then be $20. The health insurance or plan pays the rest. Yes.
Great. Adrian from Pensacola, Florida.
Oh, yes. Good afternoon, everyone. My question is, what does one do if they don't have, like, Medicare, Medicaid, don't have anything? What would they do if they need to get diabetic, supplies, meds? How do they go about that?
That's a great question. If you go onto our website, diabetes.org, we do have information and links to the companies and their free programs to get access to medications like insulin, so you can contact those. The federally qualified health centers may also have some resources available to get you connected into healthcare services. If you do not have access to insurance, you should look at your state Medicare plans and see if you qualify for any of those. But one of the things you can do, and they're not a long-term solution, but there are resources to
have access to some medications like insulin through certain pharmaceutical programs. And so you should definitely look and see if you qualify for any of those.
Great. Thank you. Maureen from Greenville, South Carolina, you're on.
Yes, thank you very much for this wonderful Q&A. My question is, what is the criteria? I have Blue Cross Blue Shield Advantage, and I have Medicare. And I am on the Freestyle sensor. And my PA suggested that I be on that. And I've been paying out of pocket for, I guess, 5 or 6 months. And she said that what we had to do was show a pattern that I was willing to check 4, 5, 6 times. Well, I'm a retired nurse practitioner in diabetes. This has been 20 years ago. And diabetes was what my field of interest was. And so, I've done that. And what is the procedure that I can, initiate with my my PA to submit to the insurance company? How do you go about appealing to have them pick up that cost?
Hi, thanks for your question. So,
I have another one.
Hey there. I'm happy to answer that first question for you. So I believe, I think what you're talking about here is if you're trying to get your Freestyle sensor covered under Medicare, your Medicare Advantage plan, your Blue Cross Blue Shield Medicare Advantage plan might be asking, it's probably the Medicare rules require you to test up to 4 times a day for that sensor to be paid for. It sounds like if you are testing, you should be able to go, I would call on the back of your insurance card, your Medicare card, you should be able to call and ask them how you submit that information. Because if your physician is, or physician assistant is saying that you're doing that, they should just be able to write a note. But on top of that, during COVID, there were during the public health emergency, they relaxed some of the rules around those things, and one of which is the testing up to 4 times a day. And that was not, has been removed for now. The American Diabetes Association is working really hard to get that removed permanently. But for now, we are still part of the public health emergency and in that. So you should not even have to provide that. Medicare should cover your sensor.
Thank you. Clarence from Atlanta, Georgia, you're on the line.
Good afternoon, and thank you for receiving my call. Excuse me. I retired, excuse me again. I retired at the beginning of this year in January. When I was working, I was a government employee, and I was with Federal Blue Cross and Blue Shield. When I went through the process of the retirement, a Medicare counselor informed me that I would have to make a type decision about, I would have to change and make a decision about the Type D coverage. I was unaware that the coverage that I had was adequate and was acceptable. Apparently, that counselor didn't know either. So I made a choice thinking that's what I had to do. As it turned out, I did not, and some of the medications that I'm having to pay through my current Type D coverage is extremely expensive for me, whereas they were far more reasonable when I was with Blue Cross Blue Shield. And my attempts to get back has so far been denied. I don't know how to go about getting back to Federal Blue Cross Blue Shield because that's where I belong, that's where I was, and that's where I want to be. Can you help me with that?
Thanks so much, Clarence. So I'm not exactly sure the rules around the federal employee program, the retiree coverage specifically, but let me tell you a couple things I do know. Again, I'm not sure if you are on insulin, but if you are, there is a new program beginning in 2021. It's called the Medicare Part D Senior Savings Model, which allows participating Part D plans to offer a broad set of insulins at a maximum of $35 per copay per month supply. That's through the deductible, the initial coverage, the coverage gap phase. I don't mean to throw these terminologies around, but if you are aware of those, it is just a flat $35 fee. That will be starting in January of 2021, so this upcoming January. All you have to do is go to Medicare Plan Finder, and you're able to search by that insulin and that you're taking, and see if that is available to you through your plan. If that is not what you are interested in, I would check to see what your coverage options are. I would go to Medicare.gov and again see if you can. It sounds to me like your prescription coverage is more expensive than your coverage currently under Medicare than your coverage while you were employed through the federal government. You might be able to also call a retiree health counselor through the Blue Cross Blue Shield Federal Employee Program and give them your history, and they might be able to connect you to some new coverage options. It's a really, really good question that you asked at a really great time because, as I mentioned prior, this Thursday, October 15th through Monday, December 7th is the 6 to 8 week period where you will be able to make changes to your health insurance coverage for next year. So that begins January 1st, 2021.
Thank you, which would be, I think, called Medicare Open Enrollment. Isn't that right?
That's exactly right. Yeah, I've danced around it a couple times in my answers, but yes, Medicare Open Enrollment, if you want to make changes to the current plan you have, will begin this Thursday, October 15th. It will last through December 7th of this year as well. We have, starting the 15th, we will have links on our landing page, our website. So that's www.diabetes.org, where you can link to www.medicare.gov. And then through Medicare.gov, you can search for specific plan options by state, by medication, by plan, on Medicare Plan Finder. Again, if you would like to make no changes and you're very happy with your current Medicare coverage, you don't have to do a thing. And if you would like to review your coverage, if you're just a little unsure about what's included in your current plan, your insurance carrier should have sent you an annual notice of changes document back in September. And then you should be able to see what your coverage looks like for the upcoming year, and if any changes had been made already.
I think you alluded to this, but could you clarify what is the Part D Senior Savings Model?
Sure, absolutely. Thanks, Carla, for the question. So the Part D Senior Savings Model is actually a new program for 2020. It's actually a 5-year program, but as an individual, you only have to participate if you would like, and it is year by year. You can switch plans each year, but for this year, it allows participating Part D plans to offer a broad set of formulary insulins. So, you do have to check if the insulin you are on is offered through this program, but it is offered at a maximum $35 copay per each month's supply. So again, as I mentioned, starting January 21, participating Part D plans will offer enrollees, more stable co-payments for insulin, and with the goal of obviously helping individuals save money on their drug costs. And as a sponsor of the program, the American Diabetes Association is incredibly excited about this opportunity. And if you have any questions about that, please visit our website at, again, www.diabetes.org, and you can find out more information.
Thank you.
Sure.
Vera from Maryland.
Yes. I was wondering, I take Trulicity, and hello?
Yes, you're on. Good.
Oh, I'm sorry. I take Trulicity, and I'm trying to find a Part D plan, and I'm not quite sure. I think I'm not understanding how they work, because I'm looking at them, and they say for the Trulicity, the cost before the deductible is $842.35. I'm just wondering, is that the actual price you have to pay before you meet the deductible, the $842.35?
It probably depends on the plan. I'll let Laura Friedman jump in a second, but if you're in a plan and you need to have prescription medication, so you need to have a medication plan, like a Part D plan that covers prescriptions.
Okay.
Sorry. Yeah, Laura, I agree with that. I've got really nothing to add. Again, if it's Part D and you have a prescription, it probably shouldn't cost that much. But I don't, again, it's a little hard to answer without knowing the details of the plan. I agree.
So Angela from Maryland, you're on.
Hi, everyone. Thank you so much for this informative series. I'm so glad to be a part of it. My question is, I'm a federal government employee, and I have type 2 diabetes, and I do mail order for my medication and supplies, but I find out that it changes, and as it was mentioned earlier, but I'm speaking from a federal employee, point. The tiers and my medication had to change, and they would not cover, so I had to switch like twice this year. I wanted to know what plans would be best for federal employees, or how do I make find out how to get assistance, even though I have a copay. The copays are very expensive with all of the supplies and everything, and it changes so frequently.
Laura Keller, was that I may have missed that. Was that a Medicare specific? Was it a federal employee?
I believe so.
Okay. That is a tough one for me. Again, if you are not on insulin, I'm trying to think, again, I without knowing the specific medications, and again, obviously it might change tiers on the formulary. I think the same answer would probably go for what Laura had answered from a previous individual, or what Laura had said to a previous individual, would be to just call the number on the back of your card and ask them at what level they cover specific medications. And you can still ask them for the information about the upcoming plans for 2021 as well. They should have that information because the plans have been approved already.
Thank you. And to our audience, if you could use some support throughout the year, there's a few resources you might want to check out. One is Living with Type 2 Diabetes program, where participants receive information through email and e-booklets that provide support and information on emotional health, eating healthy, and physical fitness, tips on managing and living well with type 2 diabetes, as well as opportunities for support online and in your community. Participants also receive 6 issues, a year subscription of Diabetes Forecast. The link to sign up is on our registration page, diabetes.org/experts. And now to another caller. Jill, you're on the line. Jill?
Hi, I am on Janumet and wondering how I can get it at an affordable cost. I'm paying over $1,300 for 3 months. Or the second part, is there another combination of drugs that I could take that would not cost me as much? I don't qualify any longer for Merck's discount program. Janumet is not formulary on my insurance plan, and I have a very high deductible. So any insight or help you can give me, I'd appreciate it.
So that's a great question, and that happens, I think, to a lot of consumers when they're looking at plans. So one thing is you could talk to your doctor about something that could work, that may be covered, to find out what medications in that same class of medication as what you're taking are another option that you might be able to use. The other thing is, as we are entering, as we've talked about, the open enrollment period, if you're buying a plan through the state exchange or through an employee plan, you can talk to your employer or look at your state health exchange plan and ask the question of what medications are covered in that category and if that particular medication is covered. So we're entering the time where everybody, including employer plans, can make changes to their plans. If you're on an employee plan, you can ask your HR person to see if that is covered, or find a plan where that medication or category of medications you'd like to take is covered in that plan. The other thing is, if you look and call the number, you can ask that insurance plan which of their plans does cover that medication. So you can do that, and or you can talk to your physician about seeing if they have another category in that category medication that you could take that would potentially have the same impact that you're trying to achieve for your health care.
Thank you. So another concern for some people is that high glucose levels increase the risk for heart disease. Does insurance or Medicare generally cover referral to a cardiologist?
Yes.
I would. Sorry, go ahead, Laura, please.
I would say Medicaid and most private insurance and employee insurance does, and I'll let Laura Friedman talk about Medicare.
Yeah, I mean, again, as you may, Medicare, most everything is covered, and a referral for a beneficiary age 65 and over who has to see a cardiologist, I would have to assume it would be. I'm not even assuming it would be covered for sure. Again, if you are, it does depend on your plan. If you are in a private Medicare plan, a Medicare Advantage plan, there are networks in your area. So if you live in Florida, for example, you just have to check the website or call the number on the back of your card and ask your insurer if they recommend somebody in network, or if your doctor refers to another doctor, you can just call that doctor's office and make sure they're in the Medicare Advantage network for your plan. But fee for service Medicare, which is just Medicare, Medicare Part A and B, again, it should, most physicians accept that.
Thank you.
Mm-hmm.
Rosanna, you're from North Carolina.
Hi, I was wondering, how do you can determine which one of the durable medical equipment is covered by the insurance? And then there's a lot of telephone marketers. And how do you make sure that they're they're legitimate?
Great question. I think one thing you can do is, one, if a telemarketer calls you, don't commit to anything, don't make any changes. Go then to the opportunity, if you have to get online, even if you have to go to a public library or something to get online, and do your research. The other thing that you can do is you can also go to your state's insurance commissioner. Every state has an insurance commissioner, and on that website they have great information about reputable insurance companies and things like that. So you can also always outreach to your insurance commissioner in your state, because they provide a wealth of information, and they're there to protect consumers from things like fraud and other things. And they're there to make sure your insurance is doing what it says it's going to do. So you can always reach out to your insurance commissioner on that. The other thing is durable medical equipment is so important. And all plans should say what, if you go to them online, what is covered under durable medical equipment, but you can always call your plan and ask. So there is a consumer number. They do have to give you that information. Most of the state health exchange programs actually have a tab that you can go and see what's covered under durable medical equipment. But if there's something specific, for example, often you might need a pump or you need a blood glucose meter, but some people would like a blood glucose meter that talks to you, particularly as you age. Maybe that's helpful. And so often those will even be covered. You just need to know ahead of time and ask before you sign up for a plan. And I'll let Laura Friedman talk about Medicare.
Yeah, that's exactly the same advice that Laura Keller said. I would say the same thing, and you can, I think that's been maybe the theme of this call today. Over communicate, ask questions, whether that's to a physician's office, your health insurance plan, the Medicare .gov team. You can ask questions online. You can call. I think, and again, our resources as well at the American Diabetes Association, the answer is out there. Again, it does take sometimes some effort to ask, but yeah. And then specifically on Medicare.gov, and again, as I mentioned, beginning Thursday, there is a tool on Medicare.gov that is called Medicare Plan Finder, and you are able to search all types of things, whether it's durable medical equipment, different types of insulins, other medications, plans. If you're just looking for options in your state, you can search by zip code, things like that, and you'll be able to see a lot of options that way. They've made a lot of excellent improvements to Medicare Plan Finder over the years.
Thank you. So we have an online question. What do you do when you don't really have a choice of insurance? I'm on full Medicaid, and the insurance keeps trying to overrule the doctor's recommendation, and I can't afford to pay out of pocket while it goes through any pre-authorization process.
That's a great question. And something that happens often is that when you're in a Medicare program, there is a formulary. And that formulary are the standard medications that the state plan will cover based on the condition. And to get an exception, all states have an exception program where your physician can override the formulary and get you access to the medications to best manage your health. And unfortunately, that process sometimes does take time and is not the fastest. One thing you can do is work with your healthcare provider in that process, and also contact the state Medicaid program and ask them to facilitate that. But your physician has to, and healthcare provider has to be the one to really initiate that exception process. Unfortunately, that is the way the system works. It's designed for the healthcare providers to advocate on your behalf. That said, the American Diabetes Association actively engages around access issues in Medicaid on the state level. So I would encourage you to let the American Diabetes Association know what state you're in, and that way we can help facilitate on the state level potentially making that system work better. So as a state advocacy director, when we hear from advocates and volunteers like yourselves that there is an issue with access to something in the Medicaid or even private insurance areas, we collect that data and then we look to see if there are levers and things we can do to help improve that for you as consumers and people with diabetes.
Thank you. We have another online question, which I think is excellent. Please address insurance coverage for televisits for diabetes.
That is a great question. So due to the pandemic, most states have allowed, and in fact pretty much all have allowed telemedicine as an option. As a person with type 1 diabetes, I've done a diabetes telemedicine visit in Washington State. It was fantastic. There's a couple things that the American Diabetes Association is working on, and that we're working to make sure those allowances are permanent, both through the federal government and through state governments, to make sure that everybody has access to telemedicine that they need. And the second part of that is that sometimes people don't have access to the technology they need. So not only are we advocating to ensure that telemedicine visits stay in place, particularly for people with chronic health things like diabetes and heart disease, but that if there are options for us, particularly on the state level, to ensure that people have access to the technologies or wireless networks, things that they need, we're going to be advocating for those things as well.
Thank you.
And I'll just chime in for one more second to what Laura Keller had mentioned. Same on the federal level, we are working both with Congress and with the Centers for Medicare and Medicaid Services to ensure those practices last well beyond the public health emergency. So I think there's a lot of support for this out there, and we hope we'll be successful with that.
Everybody keep your fingers crossed. That'd be great.
Definitely.
So Kelvin, you're on.
Yes, I get a lot of calls about Medicare Advantage, and I would like to know if Medicare Advantage can limit your ability to choose your doctor or the medication that you get, and if there are differences in Medicaid advantages from one insurance company to the next. If not, what's the advantage of all these companies touting their particular advantage program, and how exactly does it work?
Hi there, Calvin. This is Laura Freeman. That is a great question. So Medicare Advantage is essentially a private Medicare option. It is the plan is, there are hundreds of plans throughout the country. They are all under the same rules. So you might hear the term level playing field. They are all on the same playing field as Medicare, original Medicare. That said, some insurers, private insurers, might make a few, might offer some different benefits. You'll have to obviously look at the specific plans available in your state and your region. Can they limit anything? From a network perspective, for example, which doctors you choose, I would want you to take a look at what the network looks like. They are able to slim down their network in a different way. It looks a little bit more like a typical commercial plan. They usually do have very broad networks, but yes, that is something I would want you to take a look at. If there's, for example, a specific plan in your state, I would, check to make sure if you like your doctors and you want to keep working with them, I would check to make sure the plans you're interested in are covered. And then with respect to medications, again, I would ask the same questions, but generally, they would have through, this might be a Medicare. There's two types of plans. It would either be what they call an MAPD plan, which is a Medicare Advantage Part D plan. or a prescription drug plan, or you can buy a specific Medicare plan and then add on the Part D. Excuse me, you could buy, an original or receive an original Medicare plan and then buy a separate private Medicare Part D plan. So again, I would just call and ask your options if you are on 3 separate medications and you want to know what tier they're paid for and at what level. I would just ask. But yes, they are able. It does look a little different, but it's again meant to mirror many of the same rules for original Medicare.
Thank you. We have Debbie from Jacksonville, Florida.
Yes, thank you all so much. This has been very helpful. My question is, I have Medicare and a supplemental insurance plan, and I'm wondering if I change, will it affect my supplemental plan? Hello?
I think the call. Hi there.
Hi.
Can you hear me? Yeah, I think
Yeah.
you got cut off a little bit. So the Medicare, you're saying if you switch Medicare plans, would it change your supplemental plan?
Right.
So I don't believe so. I believe they operate in 2 separate realms. So if you modify that, so you would have to check. Now that I'm thinking out loud right now. Your supplemental plan is just essentially a wraparound, so it just picks up the cost of what original Medicare offers. So, and I believe it's just a flat premium every month that you pay for. So I would first check that main original Medicare plan, and then I would assume that your supplemental plan will just cover anything that the original Medicare plan doesn't cover. But that's as I understand it.
Thank you. Myrtle from Texas.
Yes. How y'all doing today? I'm enjoying this here because I just got into insurance, and it's a Medicare Silver Regional PPO plan. I was calling to see is this a good plan for me, and I have diabetes and a host of other health problems. Choosing my own doctors.
I think the question was if a specific plan would meet her needs. Did I understand that correctly, Carla?
Yes. And have her physicians in her network.
Right. I think I would, again, make a phone call to your insurance carrier and ask specifically if that, you might have to provide the name and address of your physician and ask them if that individual is in network. Again, if you're on a Medicare plan, most physicians' offices take Medicare. So you can also call your physician's office as well and ask them if that's the case. And again, you can also call Medicare and find out if the specific drugs that you are taking, medications that you're taking, are covered and at what level. And if you need something, to be less expensive or something different, you could work with your physician on that, and they'd be able to walk you through some of that.
Yeah, I agree. That is a really smart advice, to call your physician, your healthcare provider's office, and ask them what insurance plans they take, because they want to keep you, they want to have your insurance, and they want your insurance to work. So they can be very helpful in letting you know if they're in network or out of network for different insurance plans, whether that's on the state level or through Medicare.
Thank you. So another tip that everyone should be familiar with is the Diabetes Self-Management Education Programs. And sometimes when you join a education program, they can also help you answer some of these questions. Diabetes education programs provide services that focus on your concerns about your diabetes and empower you with the knowledge and skills to manage it. And they link you to support resources in your community. You can find an ADA-approved program in your area by clicking on Find a Program link on the webpage, diabetes.org/experts. I will also mention that that is covered by most insurance companies, and it is covered by Medicare as well, for those of you on the Medicare program. Okay, let's take another call from our listeners. Debbie.
Yes, hi. I hope I'm the right Debbie. I am Debbie. A diabetes educator. Hello?
Yes, you're on.
Oh, thank you. Yeah, I am a diabetes educator, and I'm also an RN, and I find a barrier with reimbursement for services provided by an RN diabetes educator as opposed to a dietitian. Can you update or give an idea as to what insurance is doing to provide that option for not only a Medicare population, but the general population under the Medicare age to get diabetes self-management education services that are covered under insurance?
I'll take the state level question and then we'll punt it over for Medicare. On the state level, Debbie, each state laws, can be different in terms of how they cover certain things. When the ADA has found that there are states that don't cover things like diabetes self-management education, we do work to increase that coverage. So that's a number one priority for us in terms of access. We've also passed Diabetes Cost Reduction Acts in 46 states previously and had diabetes self-management included in those. But, for example, some states previously had put a time or a dollar amount limit in terms of the capacity of the amount of education patients can get in either a calendar year or a lifetime. And as time has passed, sometimes those things have become not current medical standards. And so we are working to ensure that people have that access to diabetes educators on the state level in both Medicaid and in private insurance to ensure they have adequate coverage.
And I'll jump in, Laura, on the Medicare side. So Medicare Part B as in boy, covers outpatient diabetes self-management training. I believe it covers up to 10 hours of initial training. That includes 1 hour of individual training and 9 hours of group training. So you can also qualify, I believe, for up to about 2 hours, I think it's 2 hours, yes, of follow-up training each year. If that takes place in the calendar year after the year you got your initial training. I realize we're sort of talking in circles here, but essentially, I think the main thing here is that Medicare Part B does cover up to 10 hours. You do pay 20% of the Medicare approved amount, and then there will be a deductible that applies. So you just have to play with the cost there. And if you should be able to go to Medicare.gov and then or just Google Medicare.gov diabetes self-management training, and there's a bunch of criteria there that you can take a look at.
Great. Well, thank you for all your wonderful questions. This wraps up our last question for this session. A few items before we close for today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your useful feedback. Laura Kay, could you let our listeners know where to go for more information on insurance?
Absolutely. The American Diabetes Association website, diabetes.org, as well as healthcare.org for general information, and insulinhelp.org for information to access insulin.
Thank you. And Laura F., what about Medicare? So you can go to medicare.gov / for more information from Medicare, if you need more information there as well.
Yeah, thanks, Carla.
Laura,
I was on mute.
Yeah. Do you have anything else to add to that?
Yeah, and please add Medicare Plan Finder. Also, you can get that if you just Google Medicare Plan Finder. You can also get that by going to medicare.gov. You can click Medicare Plan Finder from that homepage. And beginning on Thursday, October 15th, at www.diabetes.org, there will be a link to all the Medicare materials, including the new insulin savings demonstration that we mentioned with the Part D senior savings model.
And we will also post these on the diabetes.org / experts webpage, so that those of you who have called in and said, well, so we couldn't write it down fast enough, it'll be there for your information as well. To help you feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor and dietitian about your risk. Go to knowdiabetesbyheart.org and learn more. Register for the next event at diabetes.org / experts. Sign up for diabetes education near you, and sign up for the ADA's Free Living with Type 2 Diabetes program. And don't forget your flu shot this fall. All of these links are on Ask the Experts registration webpage, diabetes.org / experts. If you have questions about this event, want resources to find diabetes education classes in your area, or would like to receive an information packet to learn more about living with diabetes, you are welcome to contact us at askada@diabetes.org or call to speak with a member of our call center at 1-800-DIABETES. That's 1-800-342-2383. Thriving with diabetes takes a village, and we're here to support you. Special thanks to our experts, Laura and Laura. I am Carla Cox, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you to our next Ask the Expert event, November 10 at 2 p.m. Eastern Time, Healthy Food Swaps for the holiday season, and our December 8 at 2 p.m. Eastern Time, The Gift of Group Support. I'll turn it over to the survey portion to close out our program. Please stay on and answer our 5 survey questions. Thank you, and best wishes for good health.
All right, thank you for joining us today. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. And for participants online, please click on the poll section below the Ask a Question form and click to submit your responses. Okay, here's our first question. Overall, how satisfied were you with today's event? Navigating insurance to get the diabetes care you need. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And I'll repeat that one more time. Overall, how satisfied were you with today's event? Navigating insurance to get the diabetes care you need. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And while we take a moment for the next question to come up, I'd like to remind you about one of our programs supporting people living with type 2 diabetes. If you have recently been diagnosed with diabetes or could benefit from a refresher, consider signing up for ADA's free program, Living with Type 2 Diabetes. Participants receive information via email and e-booklets throughout the year-long program on topics including emotional health, eating healthy, and physical fitness, as well as tips on managing and living well with type 2 diabetes. Okay, ready for question number 2. What is coinsurance? Press 1 for a monthly charge. Press 2 for a term for Medicaid coverage. Press 3 for the percentage of covered services that you're required to pay after your deductible is met. Press 4 for the flat dollar amount you pay your healthcare provider for a covered service. Or press 5 for I do not know. And I'll repeat that again. What is coinsurance? Press 1 for a monthly charge. Press 2 for a term for Medicaid coverage. Press 3 for the percentage of covered services that you are required to pay after your deductible is met. Press 4 for the flat dollar amount you pay your healthcare provider for a covered service, or press 5 for I don't know. And before we move on to question number 3, we'd like to let you know that if you missed a part of today's event or would like to listen again, you can find full recordings available by phone or on our website. To listen by phone, call the toll-free number 866-686-8240 to hear the latest recording. Again, that phone number is 866-686-8240. Or you can check back on our website, diabetes.org/expert. All right, here's question number 3. What do people with diabetes need in their health insurance plan? Press 1 for diabetes supplies. Press 2 for prescriptions. Press 3 for diabetes education. Press 4 for screening and services as required by a treating physician, or press 5 for all of the above. I'll repeat that again. What do people with diabetes need in their health insurance plan? Press 1 for diabetes supplies. Press 2 for prescriptions. Press 3 for diabetes education. Press 4 for screening and services as required by a treating physician, or press 5 for all of the above. And before we move on to the next question, we would like to remind you again that our next Ask the Expert Q&A event will be on November 10th at 2 p.m. Eastern Time. Our nutrition experts will talk about healthy food swaps and portion control in preparation for the holiday season. To register for that event, go to diabetes.org/expert or contact our call center at 1-800-DIABETES. Again, that's 1-800-342-2383. Okay, question number 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. I repeat that again. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And while we wait the final question, remember that a diabetes self-management education and support program will focus on your concerns about diabetes. This program will help to empower you with the knowledge and skills to help you manage your disease. A link to find an ADA-recognized diabetes education program can be found at the bottom of our Ask the Expert webpage, which again is diabetes.org/expert. Or you can speak to a member of our call center at 1-800-DIABETES. Again, that's 1-800-342-2383, and it'll help you identify a program in your area. Okay, here's our final question. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And I'll repeat that again. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. All right, that wraps up our poll section. Thank you for staying with us and providing your feedback on today's event. We offer many thanks to our experts, Laura and Laura, as well as the support vendors and sponsors, and No Diabetes by Heart collaboration. This concludes today's program in the Ask the Expert Q&A series. Please check out our website for recordings from this event, as well as additional resources. And lastly, if you have any additional feedback for our team, please stay on the line to leave a message. Thank you.